For many of us, work is where we spend most of our waking hours. For the 1 in 5 Canadians who experience a mental health episode at some point in their lifetime, it can then become a matter for the workplace too. So, how are we doing on creating mental health positive workplaces? Let's find out from Dr. David Goldblum. He is Senior Medical Advisor at the Centre for Addiction and Mental Health. Mark Hennick, Program Manager for Mental Health Works, an initiative of the Canadian Mental Health Association, and Gillian Coey, a mental health advocate who works in the financial services sector. And it's great to have all three of you here at TVO tonight. I want to share some stats, which I'm sure you already know, but with our viewers. Sheldon, if you would, let's bring this up. Mental illness costs this Canadian economy of ours $50 billion a year. That's 2.8% of our GDP. It costs $6 billion in lost productivity from absenteeism, presenteeism, which obviously means you're there, but kind of not really, and turnover. More than 6.7 million Canadians are living with a mental health issue. By comparison, 2.2 million Canadians, many fewer, have type 2 diabetes, for example. Okay, start us off here, David. If mental health in the workplace is such a big deal, how come we don't hear so much about it?
Well, I think we don't hear about it because of stigma around talking openly about mental illness, but that is changing. And that's changing, I think, quite substantially over the last 10 years. Obviously, on Bell Let's Talk Day, that contributes to a national conversation. But I think if you look at what Bell has done, just as an example of an organization, it's not simply encouraging other people, but it's taking on the responsibility itself as an organization. So they have trained up all of their managers in mental health awareness, and they've developed specific accommodations and return to work strategies for people with mental illness. And they've seen as a consequence their short-term disability costs go significantly down.
So there is a humane thing to do?
There's a humane thing to do. There's a bottom line business thing to do. And, you know, the effects are not all measurable in terms of when you talk to people who've experienced a positive reception in their workplace, just what the impact is on them individually can be breathtaking.
Mark, let me follow up with you on that. I gather you train employers in this area? Is that right?
Yeah.
How is it they come to you in the first place?
Well, usually employers come to us through one of two doors. The first of which is that they've heard about this great new thing called the National Standard for Psychological Health and Safety in the Workplace, led by the BNQ in Quebec, CSA, and the Mental Health Commission of Canada. They hear that all the great cases being made, that when people implement the standard, it actually does impact the bottom line and protects them from legal risk. It protects them across the board. Plus, it's just the right thing to do, and that seems to be the important case. The other door that people come through is that there's been a crisis in the workplace. Somebody's been struggling, they're thinking about letting somebody go, they're being sued. There's been a suicide, for example, in the workplace. They'll come to me and ask me, how do we fix this for people? People are stressed. There's obviously something going on here, so what can we do about it?
I don't want to sound naive about this, but we don't hear about attempted suicides in the workplace. No. Does this happen much?
It absolutely does. I was working with one company, a large multinational company here in southern Ontario. Last summer, they had 7 suicides in one workplace within the year. 7 suicides in one workplace. Now, you can imagine that the people who died by suicide, chances are they were dealing with a mental health problem or illness anyway. 90% of people who die by suicide are. But then all of the people around them impacted by that. Their friends, their families, co-workers, managers, human resources, everybody that had contact with them asking themselves why this could happen. So it's our job to come in and try to help, first and foremost, prevent suicide, but then also give people the skills to intervene if they need to.
Gillian, this is not an academic exercise for you.
No.
Why are you joining us today?
So I'm joining today because I have lived experience with mental illness. Back probably about 7 years ago while I was attending university. I was studying full-time and I was working a part-time position in the financial services industry, 10 to 20 hours a week, volunteering, extracurriculars, you know, all those great things. But what most people wouldn't have known about me at that time was that I was silently living with depression, with anxiety, and with an eating disorder. It eventually got to the point where it became unbearable, and when I was 22, I actually attempted to take my own life. I was fortunate enough that my family and my boyfriend, they knew the warning signs and they were able to get help to me in time, even though they were 4 hours away at the time. And when I returned from the hospital, I was actually scheduled to work a shift with my employer. And I was quite distressed by the fact that I thought, I wasn't going to be able to make it in for that shift. And I didn't know if I could make the shifts for the rest of the week while I focused on my recovery. So I actually had my family call my employer and let them know that I was struggling and that I needed to quit. Because to me, that was the only option
available. How did your employer react?
Well, my employer, oh, thank goodness, my manager, she said, let's take a few steps back here. She doesn't need to quit. She's a valued employee. She's a high performer. We don't want to lose her at our organization. So let's come up with a plan so that we can give her the time that she needs off to focus on recovery and then work on return to work plan so that I could return successfully to the workplace.
Was that a company-wide policy, or did you just get lucky and have a very, very humane boss?
No, I think that it's something that our organization, we have policies and processes in place to support that. And yeah, I was fortunate enough that she was aware of what could be done. Like I mentioned, this was 7 years ago. People didn't speak about mental health as much back then. So I was very lucky that she knew what to do in that situation.
How are you now?
I'm doing well. Yeah, I mean, I still, suffer from depression and anxiety. It's something that I've learned to live with and learned how coping skills so that I can mitigate the impact it has on my life. But because that manager made the decision not to just process my termination as I had requested, I've been able to go on and have a very successful career. I've held, over the past 7 years, I've held 6 progressively senior roles in my organization, and I'm doing work that I absolutely love and making a real difference in the lives of employees in our organization.
Congratulations.
Thank you.
That's a good story.
Thanks.
Is the reaction of her employer in this case typical?
Unfortunately not, but increasingly so. And that's what's promising here, is that employers are starting to get the message. I see that on the ground with Mental Health Works at CMHA Ontario all the time. There's still a lot of work to do, though, and we still see things that come up and hear stories where it makes people in the mental health sector and really just people in society say, wow, I can't believe that these kinds of tragedies, these kinds of difficult things really happen. But then you hear stories like Jillian's, and it gives you hope that these things can be changed, that even in large organizations, policies can be put in place, training can be given to managers that really helps them to deal with situations in a more humane way.
I think, if I can just jump in, though, Jillian's story is a great story because it is about that very positive human response. And we can do a lot to change policies. But, that old expression of culture eating strategy for breakfast really pertains here, because it's one thing to have a great set of policy and procedures at an organization. It's another, and I think more challenging step, to change the culture of an organization. I was speaking at a law firm, and one of the senior people there, when we were talking about the issue of lawyers who develop mental illness, said, in that scenario, he would tell that person to take a long walk off a short pier. And that is
a really sensitive approach.
That is a culture that needs to change.
I was going to say, that's a culture where if you're not putting in 80 to 90 hours a week and acting like a macho you-know-what, right, where nothing affects you,
right,
you're not considered up to the task, right?
Right.
So how do you, on the one hand, still encourage lawyers to be as tough as they need to be to survive in that environment, while at the same time, being sensitive to what they may be seeing around them?
Right. Well, I think that model of toughness is not really a sustainable model in the same way that it used to be. This was a culture in hospitals as well. If you weren't putting in 100 hours a week, what kind of doctor are you? Well, we found out that those were often broken doctors who were putting in 100 hours a week, and the toll professionally and personally was unsustainable. And so we have to rethink what it means to actually be productive and to optimize the skills that people bring in and not set up a work situation that actually in the long run makes those individuals less productive.
I suspect one of the reasons we may be changing our minds about this issue is because of one of Canada's very biggest companies, which has been all over the airwaves over the last many years with public service announcements like this one. Let's roll it, please.
Really sorry I was away again. Oh, that's okay. You had to leave during inventory. I've been feeling down for weeks. Oh, get over it. We all have our problems. Yes? I need a break. I'm glad you came to me.
Jillian, in your experience, how difficult is it for employees to open up about these very personal, private healthcare challenges to an employer?
I would say it can be difficult. You know, when you're in the midst of suffering from depression and anxiety or any other disorder, you know, the kind of critical narrative you have in your head of yourself and coming forward to seeking help, it kind of gets in the way of that sometimes. And even if the surroundings around you, whether it be your employer or your family or your friends, even if they are essentially would be supportive if you reached out, that lens that you're looking through when you're suffering kind of pulls you back and makes you believe in the stigma, and it can be difficult to talk about. But I would say through my experience, I've had a very positive experience talking about it in the workplace and being supported, back with the story I shared. And even more recently, disclosing with my manager and leadership and my colleagues. And their response has been positively overwhelming. Just the support, you know, they say words like brave and proud, and that they're happy that I'm speaking publicly about this and doing mental health advocacy work to bring attention to this issue.
Mark, can you imagine a set of circumstances where employees should not be raising these issues with their employers?
Yeah, I think that given the culture in many workplaces still, while the most effective way I think that we can start to change cultures in workplaces is by speaking up and asking for help, some workplaces aren't safe. Some managers aren't safe to do that with. And we have a national 1-800 number where we hear from employees all the time who have been let go, who are being harassed, bullied, mobbed in their workplace, very often by their managers and supervisors themselves. Now, there's a shifting legal landscape in Canada, though, where managers are being held accountable for that behavior. Companies are being held accountable for psychological injuries inflicted on their employees, for having toxic work environments like that often do give rise to mental health problems.
Do employees, David, run unsafe risks by opening up to their employers in certain circumstances?
Absolutely. Just to echo what Mark said, there are places where it is unsafe to disclose. You know, about 10 years ago, I was speaking to a group of 50 employees about mental health in the workplace. So this goes back a ways. And at the end of my talk, we had a Q&A, and one of the people there stood up and said, I just want to say to this group, I've been working with you for a decade. I have bipolar disorder. And 3 times in the last 10 years, I've been off work because I've been sick. And each time when I came back, not one of you came up to me and said, how are you? What happened? She said, it wasn't a matter of confidentiality. I would have told you. It would have meant so much to me if you'd asked me that simple question, how are you? What happened?
Why do you think they didn't?
They were scared. And she said to them, I know you all knew. I know you all saw me getting ill, and it would have meant so much to me. And she sat down and she was in tears. And then something amazing happened. One by one, each of the other people in the room stood up and said, actually, you know what? My brother has schizophrenia. My daughter has anorexia. My mother drank herself to death.
Everybody knows somebody.
It was a personal issue. Yeah. And in that context, I feel once the door has been opened to that kind of conversation among a group of co-workers, it's pretty hard to slam it shut.
I want to find out from Jillian if you had that experience in your workplace where perhaps your colleagues at work wanted to come up and say something to you after the fact, but didn't know how. Did you experience that?
So I didn't, because in my situation it was kept confidential, so they weren't necessarily aware of why I had been away. That being said, when I did return, they were very happy to see me. They said that they hope that I'm doing okay.
Did they know why you were off?
No, they didn't.
Well, they know now.
Yeah, they do. They do now. But they didn't at the time, but they still did, they were happy to see me and supportive, and they didn't treat me any differently.
If they'd known why you were away, would that have concerned you?
I mean, this was 7 years ago, so I think the stigma is a little bit stronger then, but I worked with a great group of people, and I still do. And I don't think that it would have really changed their reaction. I mean, potentially there may have been people that were uncomfortable with the topic or maybe scared to broach it with me for fear of, bringing it back up or upsetting me while I'm, trying to return to the workplace and be successful.
Can I show you? Here's I think this is what everybody's afraid of. And this is another one of those PSAs by Bell, which shows some of the skepticism that you can find in the workplace on this issue. Sheldon, let's roll that if we can, please.
Hey, have you heard about Stuart?
No. What's wrong with him now?
He's out for another month.
It's a shame. Shame for the one stuck here with all the work.
I heard he's getting treated for bipolar disorder.
That sounds bad. That sounds fake.
I looked it up. It's hard on him and his family.
Yeah. I shouldn't say that.
Okay, Mark, that is the nightmare scenario for a lot of people. How do you deal with that?
It is, and this speaks to David's point around the workplace culture. I can tell usually as soon as I go in to do a workshop or a consultation with a workplace, what kind of culture is there? You ask questions like what do people think when somebody's taking time off to deal with a mental health problem, and compare that to if they've taken time off because of a heart attack or having a baby. Or how people answer that question often gives you a good sense of what it's like in that workplace. But I think to Jillian's story, having the will and the consent and the involvement of the individual who's taking the time off or who needs time off is critical here. Our program a couple of years ago went into a company here in Toronto to consult on a case of a woman who had taken time off a couple of times, 5 or 6 times, had returned to work, and it just wouldn't stick. Every time she would come back to work, came back into a culture that was toxic, that was psychologically unsafe, and then would have to take time off again. So we went in to try to figure out what was going on. We talked to the managers and supervisors there. We said, well, what does your return to work policy look like in general for everybody else? And they told us, we'll welcome them back. We'll hand around a card. Everybody will sign the card. We'll put a fruit basket on their desk. We'll have cake in the lunchroom for everybody. So we asked the very simple question, well, did you do this for this person? Did you ask her if she would want this done for her? And they said, no. Why would she want this done? She left because of a mental health problem. And therein lied the problem. We asked the woman if she would have liked to have a gift basket on her desk when she returned to work, and she said, of course. Of course I would want to come back to a workplace that wanted me back. So taking her lead, that she would want to be included, that she was willing to disclose, that was what was crucial. She received the regular treatment when she came back, the same as everybody else. She felt welcomed, and that return to work actually stuck.
But the other challenge here with return to work is how you design accommodation for somebody coming back from a mental illness as opposed to a physical illness. If somebody's coming back with casts on both legs, everybody knows how to build the ramp, to raise the desk, do all those kinds of...
Oh, you sign the cast, it's a cool thing, it's a team building thing.
But how do you help somebody return to work who is recovering from an episode of mental illness? And they may not be completely out of the woods. They may still have focal areas of difficulty and challenge. And I think for human resources departments and employers, this is the big challenge. It's not an insurmountable one. It's about finding what are the focal areas people have trouble with and figuring out the workarounds. But all 4 of us at this table are valued in the workplace strictly for our contributions north of our necks. Right? Nobody at this table is lifting anything heavy. And so how we design accommodation for that most important defining organ that we have, our brains, is the big 21st century employment challenge in a postmodern economy.
Do you want to give fellow employees some advice on this, on how they should handle this kind of a situation in the workplace?
Yeah, so I mean, I think there's lots of things that can be done. We can talk about it more and really normalize mental illness the same way we would a physical illness, so that it's something that people feel comfortable speaking about in the workplace, to raise that awareness and also reduce the stigma.
We probably take our cues from those who are suffering, though. And if they don't want to talk about it, we won't either. Is that fair to say?
Yeah, I think that, you know, if coming forward and sharing your story is a very powerful thing to do. It makes people feel more comfortable. I mean, just recently when I was speaking about this in my workplace, people came up to me after and were telling me, you know, similar to your experience, telling me about, you know, their brother or their family member and things that they maybe hadn't shared before, or even felt comfortable speaking about in the workplace, but felt comfortable speaking to me about. I think it's important that we all as colleagues are aware of, you know, what is in place at our organization to support those around us, so that if someone does come to us and reaches out and shares what they're going through, that we can ensure that we get them to the appropriate care.
Mark, I'll give you the last word on this. A little more generosity in the workplace wouldn't hurt any of us, eh?
It certainly wouldn't. And stories like Jillian's, we know that contact-based education, people who have been there, disclosing in safe environments, sharing their stories, inviting others to talk to them, that's what really breaks down the stigma. We need to talk more because the silence is killing people.
Well, as I think everybody's saying nowadays, let's talk.
Let's talk.
And we've done it here. Good of all three of you to come into TVO tonight and help us with this. David Goldblum from the Centre for Addiction and Mental Health, Gillian Coey, the mental health advocate, Mark Hennick, Canadian Mental Health Association here in Ontario. Thanks, everybody.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.